welcome everyone. I'm delighted to have you all here on the discussion how AI-powered triage and real-time health monitoring can make the patient care much, much more elevated than it was ever. So I'm excited to be joined by Piotr Orzechowski of Infermedica. That is leading virtual triage company. Welcome, Piotr.
Hi, everyone, and thank you, Remi, for having me. Excited to be here.
Cool. Yeah. So also, I would like to welcome Kaya, who is not here on the screen with us, but she will be managing the chat over the course of the webinar, and she will be gathering all of the questions that you may have over time. So my name is Remi Koscielny. I'm co-founder and CEO of Shen AI, the company that has been incorporated 2020 with offices in Estonia and Poland. We are the leading company in the space of camera-based AI health monitoring. So I guess we start with that. First, I explain what Shen AI can bring to the table. Then Piotr will do the same, and then we'll speak how these two technologies can actually work together to bring even more value than working alone. So Kaya, if you could just share a video. So we start with Shen AI. So our technology can be integrated with any mobile app, website, or even custom hardware. And with advanced computer vision algorithms and AI, it provides over 30 health metrics, including heart rate, blood pressure, heart rate variability, breathing rate, stress, parasympathetic activity. So all of these things can be measured only with a face during 60 seconds of a scan that can be done pretty much on any smartphone or computer, right? So everything is happening entirely on the user device. So this is a very secure way of measuring. Partially, this vital signs are clinically validated. They're accurate, below 0.5 BPM for heart rate, breathing rate, 7 to 10 millimeters mercury for blood pressure. Yeah, so altogether, this is the package of vital signs and health risk and indices that can provide some important objectivity to the table. Yeah, so this is what we do, and this is the part that can be easily integrated anywhere along other technologies. So that's the recording I have made before the session, showing actually how the technology works in the real-time usage. After the measurement, there are the screens showing clearly what are the values of measured indices, and all of these informations together can be brought later on over the patient journey of the virtual triage. Yeah, so that's pretty much what Shen AI do. Piotr, over to you.
Thanks, Remi. That's a super impressive demo. Congratulations. How do you do that?
It's not easy. Yeah, it looks like a very simple on the surface, as it should. The user interface is very easy to use. Although underneath, this is a years of R&D and data collection and development. So it's really complex.
Yeah, I can imagine. So it's not only the secret sauce and some deep technology inside of it, but also the approach to user interface. Looks very appealing. Looks easy to so you accomplish something really, really exciting. So congratulations for that. So I guess it's turn to introduce Infermedica briefly. I don't know if we will see any slides, but I'll just start. Yeah, so maybe we can move to the next one. My name is Piotr Orzechowski. I'm the CEO and co-founder of a company called Infermedica. Our mission is to make healthcare accessible, affordable, and more convenient by using technology that is powered by AI that can assist patients in making right decisions when they are feeling unwell. So maybe let's move to the next slide just to give you a quick teaser of where we are as a company. We are a leading company in the space of B2B triage and patient navigation. We've been here for over 12 years. We're really proud to work with over 100 companies spanning across payer segment, insurance companies, also some public institutions, including governments, and telemedicine and technology partners. We have provided health checkups, health assessments, or symptom checks to over 20 million patients in 24 language versions. And like the core of what we have, the DNA of the company, is actually very heavy clinical curation and validation of how Infermedica works. We have a team of close to 50 medical doctors. On a daily basis. They are validating, sourcing, and improving how the knowledge graph models and captures different diseases. And so far, we've spent over 120,000 hours of physicians' work building the core of our system. So maybe let's move on to the next slide here. You can find us in over 30 countries. We started from Europe, expanded to US. You can also find us in Australia, where we have some very, very important partners for us. Moving on here to the next slide, you can see a language coverage that is really important to us because it allows us to work with international institutions, international organizations, especially insurance companies. So starting from Arabic through Japanese, Polish, Chinese, we can speak quite a few languages. And maybe moving on to the next slide quickly, one of the core problems that we try to tackle is that oftentimes, and we see it in data, people are not sure what to do when they are feeling unwell. It might be themselves, it might be their kids, children. We see in data that about 74% of patients either don't know or they choose something which is not appropriate to symptoms that they're feeling. So for example, a huge rate of unnecessary emergency room visits might be related to the fact that as patients, it's hard for us to interpret whether this chest pain is something severe or something that we can just treat or consult over, for example, a teleconsultation. And one more slide, if I can share one more. There are two ways in which we provide this symptom navigation to patients. One is called self-triage. So in other words, it's a symptom checker component that you can embed into any platform, a mobile app, a patient portal, an EHR. So it's a tool that patients can use for themselves. We ask questions driven by AI algorithm and estimate probabilities of different conditions. And the second thing, the CDSS that you see below, it's an acronym for clinical decision support. We also provide this to nurses. So when they talk to patients over the phone, they can triage them in a standardized manner, accurately. And that's what we do in a nutshell.
Yeah, thank you, Piotr. Not least impressive. This number of years and thousands of hours of physicians. This needs to be super solid. Yeah, and I believe, as far as I know, this is also clinically validated, medically certified. So this is important. Yeah, but in the presentation, you pretty much described what's the virtual triage really is. Yeah, mm-hmm. So it's either a self navigation tool for patients or for people just to provide a more health knowledge about what might be wrong, or this is also a B2B tool that providers can use to navigate patients to proper care. Yeah, so as you said, not every a symptom is necessary to visit a emergency room, which is very expensive, and yes. on the other spectrum, some of the symptoms might be unseen and can lead to the serious life-threatening situations, right?
Exactly. So the core of this is how do we help patients make better decisions, and how can we impact the decisions on what they plan to do? So of course, reducing over triage. So for example, if I go to emergency room with minor headache, that's not a good thing for my time and for the overall health system. But equally, we also see situations where, for example, people ignore serious symptoms. So maybe there's some calf swelling. Somebody's like thinking maybe it's some orthopedic problem with my leg, but it turns out it might be related to your heart, in which case you really should go. So we actually analyzed a few million of patient cases in one of our online tools, which is available to anyone. So this tool is called Symptomate. It's our showcase app, a symptom checker, symptomate.com. And what we noticed is like in about 10 in 1,000 interviews with patients, there are cases where people really report serious symptoms, for example, of heart attack, pneumonia, and so on, and they decide to stay at home versus consulting with a physician. So this triage can increase safety, but also economically drives most effective decisions.
Yes, that's it. And then like when we compare these two technologies, right? Like our technology do assessments like in a way that it objectively measures vital signs. Yeah, in a way that well, not only like it's accurate, but it's available all the time. Yeah, because speaking, frankly, like not everyone, not every moment is having like this number of medical devices that otherwise, needs to be around. And with our technology, this assessment can be done in under 60 seconds with everyday technology that everyone has. Yeah, I mean, smartphone or computer, unfortunately or fortunately, in some cases, always with us. So this can add to the whole process this objective measurements, yeah,
absolutely,
and combining these two. So maybe also like if you could say more like how in practice like a triage done by Infermedica looks like. Yeah, this is then yeah.
Yes, absolutely. So I really feel that those two solutions are very complementary, because what you collect, what we can gather through Shen AI is this part that's missing on our side, and the information about the vital signs, about your heart rate, blood pressure, body temperature, and all other vitals. It really can make a huge difference when you combine it with symptoms, and even without combining with your chief complaints, this can be enough to advise somebody to go into emergency room or to contact that doctor immediately. So the way Infermedica works, the way we engage, let's maybe take self-triage, so the version for patients. When you're feeling unwell, you open our app and we ask you about some basic information about yourself. So first of all, after you accept terms of service, you need to choose if you're doing that for yourself or maybe for somebody else. If you choose it for somebody else, you can, say this is for my child. You enter some basic information such as age, gender, and then we ask you about some risk factors. And those risk factors are very important, like whether you have any chronic diseases or the person has any chronic diseases, because that's going to control the prevalence or likelihood of different conditions that our probabilistic model will think about. And once we have this basic profile, we ask you about chief complaints, which is like a fancy name for entering the symptoms that you're having. So let's say my child is not feeling well, he's having fever, some maybe cough, and I'm not sure, is it time to go and see a doctor, or maybe I should stay at home and apply some self-care instructions. And so once we provide those chief complaints, what begins is this dynamic part of the interview. So based on all the information provided, risk factors and their profile, the reasoning engine decides which questions to ask next in a way that would imitate questions that would be asked by real doctors. So we'll ask about the duration of your symptoms, any related symptoms, exacerbating factors, We cover over 870 different conditions, so that's quite a lot. So that includes everything from common diseases, rare diseases, tropical diseases as well, and over 1,700 symptoms. So that's quite a lot. And the goal here is to ask only the most relevant questions. So after like 12, 15 questions, depending on the severity of those, we arrive at the results page that tells you, okay, look, your child might be having some mild acute bronchitis. Try this at-home remedies. You don't need to see a doctor now, but if the cough persists or if the fever is higher, then you should, for example, go and see a doctor. So what we display is an overall triage assessment. Secondly, we provide patient education articles that are also curated by our medical doctors, and the ranking of most likely conditions. So even though, of course, these are not final diagnoses, we learned that you want to show those conditions because they provide much needed reassurance to the patient that we know what might be happening. So the triage level itself is not enough to drive this change of intention and behavior. You want to say, okay, this might be flu, this might be COVID, this might be something else. Then this results page becomes much more complete. And where Shen AI could help us here is in multiple parts of it. Before, after, within it, there are multiple options and configurations I can see where those two tools could be supplementing one another.
Indeed, yeah, it's I believe that with this contextual journey inside of the triage, as you said, like not always the same questions appears because this would make no sense. So I believe like having like this initial vital signs at disposal, then this could also make some I believe good guidance insight. Yeah, so like because now I believe like perhaps there is like a question like about heart palpitations or things that actually are coming from some physiological changes in the body, like high heart rates or high blood pressure or breathing rate or blood oxygenation, so on and so forth. Exactly. And with this objectivity, obviously this will be like not the subjective feeling. It will be just like a specific number.
Absolutely, Remi. So this is exactly the case. So one of the use cases that would improve the accuracy of the triage, and I think also improve the patient or user satisfaction, because like you want to feel that you have received a very thorough evaluation, although this is not a replacement for talking to a doctor. In the sequence of questions, yes, we will ask questions such as body temperature, heart rate, oxygen saturation, blood pressure. I think a much better approach actually than relying on patients. And by the way, they rarely have those answers. So they are not walking around with, with blood pressure monitor or something like that, or even thermometer. I think that would bring a lot of interactivity, and maybe it will be like an enjoyable part of it, of the process. But what's most important, we collect very accurate vital signs from you that can supplement like the reasoning of our algorithm. So I think that's a really great use case. This can happen dynamically during the interview, so like triggered by the combination of symptoms you have, because there might be also a combination where vitals are not that important. Maybe I don't know, maybe I scratched my finger or something like that. Or this can also be a core part of the process where at the point of collecting chief complaints or main symptoms, this is where this can be triggered at the beginning. So we have a fuller picture as we enter into this funnel of dynamic questions.
Yeah, I was also like curious a bit that like you said that even after the whole triage, people are not so much convinced about this potential like a reason about this how they feel. So I guess again, providing them that's indeed blood pressure being measured, highly elevated. It's not only the impression is just a real number.
So let me give you an example, because our goal is to, and I guess your goal is the same, is to improve well-being and overall health of people who use our tools. So imagine this. At the end of the interview, like we show the results page, and we suspect there might be high risk of hypertension, or maybe some metabolic disorders, but let's take hypertension. And this is like, hey, you know what? Maybe you want to actually measure your blood pressure or use Shen AI, and we'll just confirm it. So it's like I want to say it's like a call to action, a kind of a hook that really can influence the patient to take this recommendation much more seriously. Because not only you went through a questionnaire, but then you had this vital check that maybe you haven't done before yourself for quite a long time. And afterwards, like, oh my God, so indeed, something might be happening. And then you can connect somebody maybe to some further reading or articles. So I think that could really work well.
Yeah, and I guess both information taken by this questionnaire that is available through your technology and measured by us, can be then taken, further through different APIs to the, EHRs or whatever systems actually that professionals can use just to get the bigger picture of this patient that perhaps came later for a visit.
Yes. Absolutely. So this interoperability is part of it, and it's also about improving the quality of what we learn about the patient ahead of the visit, whether this is teleconsultation or in-person visit. So of course, and we talked about putting a vital sign measurement at the end of the triage process, but I also think we can put it at the very, very beginning and use it more as a segue to invite people to perform the triage, like a more detailed triage check. Because if we take this case with hypertension, I can imagine like a completely reverse situation. Somebody is using Shen AI, turns out blood pressure is elevated to some vital signs that should be looked into, and there might be a prompt saying, hey, would you like to provide some additional symptoms and take you through like a quick questionnaire so that we can rule out some options and advise on what to do next. So of course, I'm not talking about emergency situations, but if we think about hypertension, maybe the patient will say, yeah, actually I have this, throbbing headache once in a while. Sometimes I have shortness of breath, I'm losing or gaining weight, so Shen AI can also be a trigger to direct patient not only to our tool, but any tool that is tailored for that particular problem that has been measured.
Yeah. So that's very true, and I believe that most of the use cases we are seeing today where our technologies are being used are remote, or digital, fully this context of patient being on the one side of the globe, even the professional being on the other. I wonder that you have seen or you have actually done such settings where this triage is made on the entrance to the, let's say, hospital, right, where all of this information needs to be taken right now pretty much manually, right, both like the symptoms and the measurements.
Yeah, so that's a great question. So for sure we tried it. We tried it in some clinical settings or maybe waiting rooms of emergency departments. I cannot think right now of any live deployment of such case, like in this traditional setup. I think there were some challenges related to the way emergency room works in general, like even like the most basic thing, which is what should be the device? Like, should we have somebody there standing with a tablet or, or how to like logistically do it? But we had cases, for example, where in Africa, in Nigeria, there are community health workers that would take Infermedica, integrate it into like a tablet-based app into rural areas, some remote areas, and they would use Infermedica as a clinical decision support tool, right? So yes, you can take it. And I think over there, I assuming like with the limited access to devices and other means of taking those measurements, I think that's also super powerful. I mean, overall, like the value proposition behind eliminating of those auxiliary tools, medical devices you have to carry somewhere in the bag and they can be broken and you can use them incorrectly versus having just your phone is just like extremely powerful.
Exactly the similar case, just in a different this was like a Southeast Asia in a few countries, like we also like provides Shen AI to like this on-site caregivers that were across these rural areas, right?
That's
also
great.
Like we have this like a caregiver mode, like usually like you measure yourself with the front camera, you can change and then just measure someone else. So the virtual triage, I believe the most use cases as we are seeing today is they are like a remote, like a fully digital, in the web or mobile. There might be some future use cases. I mean, same here, like in clinical, and also like this is like for rural areas, right? So where those kind of devices or knowledge is not so much available. So I guess like as of today, our customers they have to use these two technologies in some way together. So either us being doing this initial assessment, then Infermedica, or other way around. In the future, perhaps, who knows, there will be a way to integrate this more closer, just to not only to provide two streams of this information, but one that support each other. That's the future, perhaps.
Yes, absolutely. And the core of this is the implementation effort. It's of course easier to integrate one platform that has both or multiple components than to maintain two separate deployments and stitching them together. So that's definitely on our roadmap, Remi, to make that happen. I think on our shared roadmap.
Okay, great to hear. So I guess we'll be ending here and opening floor for any questions. So Kaya, if there are some, please, put them on the chat. Or let us know there are no questions as well. That's fine. Oh.
Okay, how do we measure success? A question from Sherry. Thank you so much. So it depends. So what we do, we focus we focus on partnerships with payer type of organizations. So they typically have shared goals related to, for example, reducing unnecessary visits, or to promoting self-care, or promoting adoption of telehealth services versus in-person visits. So what we do with each of our implementations of our partners is we start with a whiteboarding session. I don't think that kind of technology is something you can take off shelf, a solution where something fits everybody. We have a very nice process where we sit down with a partner, talk to them about their problems and what we can offer, and actually every client, although it's in the same area, everybody will set their metrics slightly differently. So to give you a few examples, we have quite a few case studies we published with our clients that I'm always happy to share. We work with a government-funded institution in Australia, and we provide these triage tools to over 23 million Australians. And one of the core KPIs that they have are around reducing a number of unnecessary emergency room visits. And once we rolled out, we can see like a stable trend where this rate of emergency room referrals patients received through their portal or a nurse line is decreasing. For somebody else, this will be about replacing in-person visits with teleconsultations because they have such offering. For somebody else, this will be more of an operational efficiency gain because collecting interview ahead of a visit can also shorten the duration. So I know it's a slightly maybe extended answer, but it depends on the type of client and also their particular circumstances, but it's always critical to set this KPI before we start the actual work.
Hello.
Hello, Andrei.
Hello, everybody. I don't know if now everybody can see me and hear me.
I believe so, yes.
Oh, perfect. I just wanted to make a few notes because this is for me a magical setup. Instead of writing, I'm better in talking. So it's great to see you both. I am Ondřej Svoboda. I am from Czech Republic, and we are a virtual clinic called Dr. Digital from Czechia, and we also do Slovakia and Eastern Europe and Caucasus region. We work with Shen AI for more than a year and a half, and I just want to address two things. My background is 15 years in medical device distribution, so sales and regulatory is my daily bread. And there are few solutions like Shen AI in the world, but we picked Shen AI because it's the best one. And I did a thorough research. And I have to tell you, the other guests, that I did the research also about the triage or symptom checker kind of tools. And Infermedica also turns out the best. So through my expertise, we independently on this call chose these two solutions from all around the world to put it in our service. And just to match the words said by you two guys, now we are negotiating with Infermedica, so we will implement it hopefully this year. The case for us is the effectivity of the operations, because we are a virtual clinic, we are a medical care provider, so we do mostly telemedicine consultations, and we also do assistant services, so we book our clients. And most of that work was done manually and not standardized. Every doctor in different hour of the day, depends how tired or angry he is, asks the questions differently and does the triage differently. And we need to standardize it. And Infermedica is very, very good at it because it's determinative model rather than all the GPTs and other kind of interactive tools we tried. This is exactly something that what you put in, you know what you're going to get out. So this is amazing for the teletriage. And the Shen AI, I mean, this is no news for anybody. 40% of us will be killed by the heart, and it's so expensive at the end. So all the hospitalizations and everything around it is very expensive. And the final stage, and it's super cheap in the early stage, it's just to check it regularly. But today's generations, and not even our generation, but the generation of our parents, they don't take this cuff measurements devices, the tonometers with them. They don't have them. And when it comes to blood pressure and the heart markers, it's not about one measurement. You need the trends, and you need them a lot. And you can't do that with having the cuff device. Okay, now I'm silent. Thank you for my minute of fame.
Thank you, Andrei.
Thank you, Andrei. Also, I really appreciate it. Like, it's a nice coincidence that we met on this call, and also appreciate your kind words. And I think you also mentioned something very important, if I may maybe elaborate a little bit. because Andre, you mentioned about GPT kind of models versus what we offer. And I think, you know, I don't need to convince you and hopefully anybody on the call, but it just has to be a medical device, you know. If you look at ChatGPT terms of service, like it's forbidden to use it for triage and there's no clinical validation. I think there's a great potential in those tools if we use them wisely, but I think in a situation where based on the output of a tool, what we're waiting is people's safety. I think this explainability and transparency and clinical validation, you know, doctors approving the tool, it's, in my opinion, more important for safety than like a freestyle, free flow conversational capabilities that can be used on top of what we have, but not alone if we really aim to improve patients' safety here. And also one comment, yes, I think Shen AI is outstanding technology. It's like coincidence we met in the same town because like that's like where Shen AI also has its offices. So you can say we are also neighbors, not only on this particular conference call.
Yeah. Also, like I think Andre touched like two additional points we haven't talked before, like the standardization that Infermedica can provide, comparing to just like this, you know, LLM models, like despite all of this, you know, security and safety things you mentioned, Piotr, and also like maybe this is like even a topic a bit not beyond, but next to virtual triage, which is like the health monitoring for chronic conditions. Yeah, so maybe this is like a more for us that we can provide this information over time and build a trend. But this is like another use case that we actually have been talking about this on the previous webinar, like with Hatry, the application that actually manage the hypertension. Yeah.
Yes. So we received, I don't want to say a lot, but quite a lot of requests related to condition-specific symptom checking or triage. So, for example, if somebody has asthma or maybe, you know, diabetes, can we provide a tool that would be just focused on that particular domain and maybe look for complications, maybe, you know, provide some well-being instructions? That's something we're potentially considering.
Okay, so specifically for some chronic conditions, the triage and some sort of navigation, after, as I understand.
So exactly, that's something we're trying to sort out. I think where does the need comes from? I think for sure pharmaceutical companies really want to make sure that patients with chronic diseases, patients on drugs, remain engaged in the treatment. I think like dosage and skipping dosage and forgetting about it, I think is one of the problems. So perhaps being in the loop by providing some sort of interactive agent that checks on your symptoms could help, you know, to stay on the proper treatment.
Yeah. All right, cool. Kaya, do we have any? Yes, we do.
Okay, so question from Nick. Is that question to me or Remi to you? I think maybe for both.
Maybe for both. Not sure like how close are you to the UK market, Piotr?
So for some reason, like UK has never been like a market where we were present, but we are in several conversations, including some, I think there are some NHS tenders happening around patient and virtual triage. We're not doing it alone, but we're in a partnership with some larger organization. I think, you know, what we have in Australia is actually, I think, a very similar health system as they have in the UK, as you have in the UK, because of course there's like obvious inspiration there. But visits to a emergency room are free, but very expensive to NHS. So in Poland, the situation is exactly the same. In the US, if we think about it, it's also the only place probably where they have to treat you if you are in a life-threatening situation, and then you need to sort out how to pay for it. So ideas how to drive the adoption, how to get the public to use it if the emergency room visits are free. So I have one thing I'd like to say based on our experience. And like very frankly, we have instances where patient triage worked great, it worked fantastically, but in some other places where adoption was very low, like it didn't pass through. And when it comes to, in my opinion, when it comes to public settings, so we work with several public institutions. So I mentioned Australia. We work also with Ministry of Health in El Salvador. So Central America, we have experience working with Polish Ministry of Health, Ukrainian Ministry of Health, and some others. I think there must be proper placement on the side of this, national system. So in other words, I think if the Ministry of Health or the public system promotes that actively and puts their own credibility behind it, it's much easier to drive adoption. I think it's much harder to achieve in a private setup. If you leave it as an optional tool, people probably won't be very eager to use it. If you embed it as a part of the workflow, then yes, it will work. But I think it boils down to the credibility and exposure that you can get from this public institution. So I'll pause here. Maybe Remi, you have a better answer to this one.
Not that much to add, as actually we have not been working directly with any national health systems, but in general, it's as you said, it's much more difficult actually to engage people with preventive health. Because usually this virtual triage happens when there is some significant reason. A person might be needing, looking for. So instead of looking at Google MD or a Chat GPT MD or whatever other LLM networks, it's maybe better to go to, or have a place actually to go to these systems that are safe.
I'll just say one more thing, that in the NHS 111 actually features an online symptom checker. I think it's one of the first government or public deployments of a symptom checker. It's not AI based, it's like an old-fashioned rule-based system, and I think they still get a heavy usage of this one.
Okay. All right. Okay, that's for me, I guess. So yes, the other a use case, which is kind of like a virtual triage, is the telehealth consultation scenario. So we integrated already with few platforms where we are after or before any form of the virtual triage. Again, some of them are simpler than Infermedica is doing. Some of them are Infermedica indeed. But this is the pre-consultation, vital signs check / reporting the symptoms that gives a professional that conduct the consultation. After that, much more information about the patient, because without such tools, professional can only rely on the information that a patient reports. And again, this is this lacks subjectivity. This lacks objectivity. Even so, the measurement could be really done. This could be done on the devices that might be not calibrated, or measurement can be done in a wrong way. Unstructured, yeah. So again, what we have been talking before, like a patient can say anything without any significant structure. With this information, a professional can have much better understanding about a patient being. How much time typically it takes? The integration is super easy. Yeah, so we are having a very nice online configuration tool that allow our customers to make a full customization of all the screens, how they look, what kind of information our customers decide to display. And after such configuration done like visually in the tool, then there's like a simple call to just get the technology up and running for a patient. And then additional perhaps work to do is just the APIs that needs to be connected. We have some of them actually we can support, like the FHIR protocol, just to transport the data to another systems. So this is like a days or weeks, depending like how complicated the system is, but it's really like a very easy and quick to integrate. Shen.
All right. Question to Infermedica. Is this available to the patient through their portal, and is your solution integrated into EMR for any clients? Just let me pull up one note on that. But in short, yes. Informatica can be integrated into any EHR, but when it comes to out-of-box integration, we provide support for Epic and Cerner. So two of like the biggest ones in the US. Of course, more can be added. We have like a framework that allows that. And oftentimes what happens is, now let me explain it easily. Many times our partners just prefer to use our API. So not the whole experience with the user interface and so on, just like the API to our core reasoning features. And we have like a number of examples here, including Optum in the US. They integrated us into their like health system communication platform, messaging platform for patients. But instead of like taking the whole user interface for us, they just like make queries to API and they can do pretty much whatever they want. So yes, we have such instances, plus we have support for some biggest EHRs right now. I guess question for both.
So I guess one by one. So we are in the process of CE certification, which we have in plans to get first. So right now we have like a clinical evidence based on clinical trials. Yeah, so we conducted trials that confirmed our accuracy, and the CE mark, including blood pressure, we expect to have next year. So until that happens, we operate on the real world data basis. Yeah, so the readings from the technology can obviously, and they provide the same accuracy and level of information. It just they cannot be solely used for diagnosis. Yeah, for diagnosis. So that's where the virtual triage actually is making the triage, which later on often needs to be confirmed by the next steps in the healthcare. So that was like longer answer. Shorter is that not yet, but this is our goal to have both.
Okay, so my take, yes, we're a medical device class 1 based on the MDD directive, but we're currently pending registration audit for class 2B. So I expect that around end of the year, beginning like next year, we will upgrade to class 2B. And when it comes to FDA, FDA has a sort of I would say exception or enforcement discretion, where tools such as Infermedica or tools that support patients qualify as low-risk medical devices. You don't need to certify as an FDA-approved device, because that's like the regulatory framework that's out there right now. There are no symptom checking triage tools certified under FDA. There's an exception for it. So maybe I'll take this one first. Thank you for the question. I do think it's a match made in heaven, because both tools provide different capabilities and make it much more objective. So our API and our reasoning algorithm does take into account the vital signs and also lab test results, by the way. So it's like very basic here. Like I see it like very simple way. At some point, once vitals are connected through Shen AI, those can be transferred to the sequence of questions. And from that point, our reasoning engine will take that into account. We'll recalculate probabilities, we'll recalculate triage, and we'll modify the sequence of questions to adapt for this new information received. So that will work seamlessly.
Yeah, nothing to add. Fully agree. So many questions. That's so cool. Yeah, so this I believe the question has been answered. The clinical grade in a way that the accuracy of the vital signs are within the range. As I said, the medical device certification is pending. Yeah, so not yet we are approved medical device. Although, like as I said, right now we are operating under the real-world data basis. Yeah, so the class of the information taken by Shen AI is the same class you may take from wearables which are not medically certified. Yeah, great question, Tom. So indeed, like there is like a sometimes a big problem with traditional BP monitors that not only might be used in a wrong way, but often they're just uncalibrated. So they are given like a wrong measurements, even though they're used properly. Yeah, and in our case, our technology actually makes the analysis from many biosignals at the same time. Yes, unlike the other competitors in the space, we are not only using RPPG signals that are visible on the face for the camera algorithms, but we are using also like a different modalities of this data. That is giving us a more depth in the data to reason for AI networks. As well, we are having this we call it a multi-tonal sensing engine. So this is like a component of the technology that work across all of these components, and it improves greatly like the environmental conditions under which a proper accurate measurement can be done. And those conditions, and actually this is the most challenging for such technologies that are based on the camera readings. Those are like the strength of the light, the level of the movement, like during the measurement, as well as the skin tone. Yeah, the darker skin tone is the less translucent than the light one. So those are the challenges that we have cracked successfully, right? So right now we can provide the widest range, but there will be always like some limitations. Yeah, like if there is like a very very little of light, or if the movement is really high, then the measurement might be too low quality to actually provide. But in that case, we are having our internal quality measurement system. Again, unlike the traditional device that just give you the results. This mechanism knows when the measurement is unreliable, and in that case, if it's so, that it won't be given. Yeah, so there will be information that it needs to be done again. Yeah, I mean, we have some, at least speaking for Shen, presence in terms of customers. We do have as a company, we operate digitally fully, and yeah. So I guess simple answer is yes, we do. All right, so we're getting to the end. By the way, not sure how many questions left, but we have only 4 more minutes. Maybe it was the last one.
Yeah, maybe.
Pretty much, it seems so. Yeah, so we invite everyone just to take try both of these technologies. So here's the QR code just to make a minute health assessment with us and to test Shen AI.
I need to do it myself.
Okay. All right. Cool.
So,
and is there one for symptom checker? We can display?
Well, I think I forgot about it, but no worries. If you go to Infermedica website, I'm sure you'll find it. Otherwise, Symptomate is our B2C showcase app, so you can test yourself there as well.
Okay. All right, cool. So that's going to be it for today. Thank you everyone for joining us, listening this discussion. I think this was a very, very nice one. Thank you, Piotr, for being here, talking with me on this.
Thank you, Remi. It was a great conversation. Appreciate everybody's time, and please stay tuned for more news on our cooperation.
Yeah. Thank you so much. Have a good day or evening, depending where you are. Thank you.
Thank you.